everyone joining us. We're here today to talk about sports medicine, and with me I have Dr. Ashbaugh, and I'll ask him to introduce himself.
Hi, I'm Dr. Andy Ashbaugh, and I am a sports medicine physician here at Valley Medical Center.
Great, thanks for being here. So can you please tell us, what is sports medicine?
Sports medicine is a branch of medicine that deals with physical activity and the prevention and treatment of injuries related to exercise, sports, and aging.
Here at Valley, do you only treat athletes or do you care for other conditions as well?
In sports medicine, we believe that all patients are athletes, and whether or not you're training for an Ironman or you just want to be able to walk your dog without pain in your knees. We treat a wide variety of conditions such as arthritis, bursitis, and carpal tunnel syndrome, as well as injuries to muscles, tendons, and joints.
And do you care for patients of all ages? And are there any conditions that are not appropriate for your clinic?
We see patients of all ages. There is no upper limit on age that we see in the clinic. In fact, I just saw a 101-year-old woman last week for shoulder arthritis. We also do not have a lower limit on ages seen in our clinic. However, based on our specialty, we typically do not see patients under the age of 5.
And if someone has an injury while they're exercising or playing sports, say maybe like a sprained ankle or a concussion, where should they seek care first? Meaning, should they start with urgent care or the emergency department? And when should they go to primary care or somebody like you in sports medicine?
There are numerous options of where you can be seen following an injury. For example, if you're exercising and you roll an ankle and you can't put any weight through that ankle, you do need to be evaluated more immediately. Urgent cares are a great place to be seen for that, as you can get an x-ray done there. If the injury is more serious, such as an open fracture, then that would definitely be advisable to go to the emergency room for that. If you're able to put weight through the ankle, then you should be able to self-treat this at home for a few days with icing the ankle, elevating it, keeping some compression, and taking ibuprofen or Tylenol to help with the pain. If after a couple of days of doing that and you're still having quite a bit of pain, you can either be seen by your primary care physician or here in sports medicine.
What treatments do you offer in your clinic for injury recovery or chronic conditions like arthritis?
We offer a wide variety of injections to help treat chronic conditions and overuse. We do cortisone injections, artificial joint fluid injections, and platelet-rich plasma injections, or PRP injections. A cortisone injection can be very helpful for an arthritic joint or a bursa that is acutely inflamed and painful. Artificial joint fluid injections can really help knees function better, move better, and is akin to getting an oil change for your knees. Platelet-rich plasma injections can be very helpful in more longer-term pain control for joints with mild arthritis or chronic tendon issues, whether it's a partial tear or overuse.
I understand that you use ultrasound when you perform these injections. Can you tell us a little bit more about what that is and the benefit of having ultrasound?
We have an ultrasound that we can use to guide our injections. This allows us to get the needle into the precise location of the problem and make sure that the medicine gets right where it needs to be. This has been shown to make the injections less painful and more effective.
With many people returning to sports or activities this summer now that they're vaccinated, what recommendations do you have to help them prevent injuries?
With the pandemic hopefully coming to an end and more people getting out there and exercising more and participating in sports, I would advise that you start slowly and gradually build up to the levels of activity that you were at prior to the pandemic. If you try and go straight back to the intensity that you were doing prior to the pandemic, there's a higher risk of injuring tendons, muscles, and joints. Make sure that before you start exercising, you warm up really good to loosen up your muscles and your joints. When you're done exercising, spend the time and stretch out all your muscles and joints. If you're sore after exercising, icing, stretching, medications like ibuprofen and Tylenol can help quite a bit. And if this isn't helping, we'd be happy to see you in the sports medicine clinic.
Great. Thank you so much, Dr. Ashbaugh. For those of you watching, we'll have information in the details for the video and where you can learn more about Dr. Ashbaugh and the Sports Medicine Clinic here at Valley.